All right, Kenny, I really appreciate you coming with us again and coming back. And it's been a few months now since we last saw you, and so we're just going to talk just a little bit about how life has been and about your new smile. So, what does life feel like today with your new smile?
It feels great. It feels more welcoming. I know that sounds like cliche or harsh, but I feel like when you have like a decent smile or a good smile, like you don't have to worry about that's the first thing people are going to notice. And I feel like it's more inviting in terms of you feel more invited into a conversation, I guess, if that makes sense.
If you had to describe this whole journey in one word, what would it be?
All right, Candy, I'm so glad that Revive connected us together and that you get to have a new smile.
Me too.
Candy, what would you say to anybody who was considering coming to Revive to get any kind of procedure done?
I would say don't consider it, just do it.
Yeah.
Yes.
Tell me about yourself and how you got here today.
My name's Candy and I'm 38 and I was born into a broken family. So I was born into both my parents were addicts and in turn that sort of broke me, that lifestyle growing up like that. The level of care that you get, I don't really believe that you can get anywhere else. The relationships that you build there, like that's the main thing that I love
Yeah.
about Revive is like you walk in there and it's not just like a patient doctor relationship. Like you feel like friends, like you
Yeah.
feel like they want to build relationships with you. Like they take the time to do that. And I think that's really important when you're very vulnerable, like when you're in a vulnerable state, like it's, yeah.
All right, Lord, we just come before you today, and I just thank you so much for Candy and for Revive and just everything that you're doing and everything you've put together, Lord. Thank you for blessing me with such a great opportunity and allowing me to be able to bless Candy with the same thing through Revive. I pray for her surgery, Father, that you'll just be the hands of the doctors and all the people that day, Lord. And just let them serve you and work for your glory, Lord, I pray. And I just praise you and thank you for everything that you have done and everything you're going to do, Lord. And I just thank you in Jesus' name. Amen.
Amen.
Tell me about your faith journey.
Okay, so my faith journey started in 2020 when I initially entered into the women's discipleship ministry in Bangor, Maine called Blessed Hope. I entered as a resident. I finished my year commitment, and then I was asked to do leadership there. And that was a year commitment. I finished that commitment, and then I had the opportunity to walk it out. So I ended up going back home to Indiana. Um, and then I just started reverting back to my old ways, and everything got really dark really quick. And then I reached out to Peggy Bruning, who runs Renew Women's Ministry here in Chattanooga. And I told her I needed help. Like I knew where to turn. I knew I needed to turn back to the Lord, but I just didn't know how to get there. I just needed that help. So I called her and she said, "We have a bed for you." So I entered into that ministry. But that's really where I developed my foundation that I have with the Lord now. Like I let him into those unspoken spots, those spots that I wasn't really willing to let him in the first time.
Yeah.
And that's really where I allowed him to develop me into the woman that he intended me to be and not the woman that I was told I was or that I was molded into by just the world. So
Yeah.
I just continue to sit at the feet of Jesus. And that's basically what Renew is. So Renew is a women's discipleship ministry that is a safe place for women to apply the truths of God's word to their life.
Hi, my name's Peggy Bruning. I'm the director of a ministry called Renew. And Renew's a place where God draws broken women who are coming out of addiction or life controlling issues, and he really just sits them down at his feet and he lets them learn who he is. We use God's word to help them find truths, discover who the character and the heart of God, and then find direction for their life. I've had the privilege of getting to know Candy. She came to us a few years ago and had had a couple of starts and stops, and she would get her footing, and then just hard things from her past would come and grab a hold of her. There was so much brokenness, so much lack of confidence in herself and her ability, and I just watched God get a hold of her, and she just flourished, still really just wanting to offer herself not only to get healing but to help others. Lots of lack of confidence, though, just afraid of making the wrong decision, afraid of not doing it right, and that was all stemming from her past struggles and just not good role models. And I just have watched her flourish. Candy has a heart to serve. God says, love me and love others. And I've watched her really surrender her life to the Lord. On a personal note, Candy's real special to me because she just is one of those people who just says, I want to learn what God's taught you because I want to change too. So I love getting to be part of her world. I've loved watching God grow her in her heart, in her confidence, and she's a gift to the world. She really is. Wherever she goes, she's worked at a job, at a corporation, at Timber Root, and wherever she goes, she advances because she just gives her whole heart. So that's what I know about Candy.
Can a smile impact your life or a job?
100%. Yeah. I think it can impact your whole life. The way that you interact with people, the way you engage with people. I feel like it's held me back from a lot of things in my life. Relationships, not even wanting to enter into them because I'm insecure,
Yeah.
not wanting to get up close and personal with someone, not wanting to even engage in just a simple conversation just because I am insecure.
When did you notice your smile getting choppy or falling apart?
Okay, so that's the thing. So I feel like I've always had this burden of not being happy with my smile. My family could never afford braces, so the bottom set of my teeth are very jagged, and I was always made fun of. I was really always uncomfortable with them. And then as far as my top teeth, I noticed about 10 years ago that they were starting to break. Like my lifestyle was very hard on them. So I would be in the middle of dinner with friends and they would just start falling out during dinner.
Yeah. So was there any pain?
Yeah, there was a lot of pain due to the breakage and certain things being exposed. Like I found that certain foods would irritate it, the temperature of foods. Like I remember sometimes I would wake up in the middle of the night and it's like a pain that you can't explain. And that would keep me up and I've lost quality of life at that point. Yeah.
Tell me about your denture now and why you're unhappy with it.
I'm not confident with it at all. There's a lot of movement. It gets uncomfortable at times. There's a lot of taking out and putting back in. There's certain foods that I can't eat. Like even with the adhesive glue, there's still certain things that I can't eat, and it's just the movement. And I don't even want to be around people when I have a meal just because of the sound sometimes.
How do people treat you differently with a choppy smile?
I feel like it's more how I perceive it. Like I feel like there's just constant judgment, or I feel like they can't get past it. I feel like it gets in the way of everything that I try to do or everything that I want to do.
Yeah.
So as far as how they treat me or how I think they treat me, I just feel like it's like a sore thumb. Like it's just always out there being looked at. So it sucks.
Did you go to the dentist?
I did initially, and then they would just start pulling out. I would start losing my teeth little by little by little. And then I found that I wasn't able to eat certain foods. And then I got to Renew, and someone had mentioned Revive Dental, that they deal with people that are in recovery. And I was really drawn to that because I have a lot of guilt and shame from my past. And I carry that. And I just felt like since they had already dealt with people like that, that I could walk in there and I could be comfortable and I wouldn't have to carry all the shame and guilt and all the embarrassment with me. Like they would understand me and they would accept me as just a person.
I'm Dr. Jamie Kumar, and I'm here as a resident and dentist, and currently am here for this year, just learning under Dr. McCracken and staff here that come through Revive. Loving it so far.
I'm Mackenzie Keith. I'm Dr. McCracken's partner. I've been with him for 4 years. I handled the business side and also partner with the dentist as far as teaching them throughout their residency. Really hone in on like comprehensive care, getting patients back to recalls, and help giving them the confidence to come out of residency ready to take on a full practice.
I first heard about Revive's dental program from a classmate of mine who had been in the program. So I remember vividly, it was his 4th year, my 3rd year of school, and he was like, I found the gem of a residency. You can never find one as good as the one I found, and I got into it, and y'all should come down and visit when I'm here next year. So we came and we checked it out and saw the amazing work that was being done by people that were 4 months out of dental school, doing things that you would barely even imagine most people do in their careers as dentists. And we're like, this is incredible. This people, the heart and the soul behind what Revive stands for is also what really drew me in, because I knew I could be serving Christ as I was serving others, and that's something that Revive really stands strong on. They don't try to hide that, and I love that about this program and the place that it is.
And I would say like that's a good point of who Revive is made up of. Like Revive is made up of people that fit together as like a Tetris point. Like we have people who have been in addiction that work for us, or have been in an abusive home that work for us, or have been in foster care that work for us, or have come from beautiful homes and just want to help serve a community. Like all of our backgrounds are so different that like it almost allows us to give like unmatched care, because we have those same kind of patients who are divorced, who have come from sex trafficking, who have come from addiction. And when you have all these people who are staff members who have maybe experienced a glimpse of what these patients have, like it's just a lot different. So I think that's one thing that sets it apart too.
So was it true? Did they really treat you right?
Yeah, they did. So from the moment I walked in, I was very comfortable. They were very like welcoming. Like I didn't feel like a patient. Like I felt like a human being. Like they wanted to have a relationship with me. They wanted to get to know me. They asked me questions. They just made sure that I was taken care of. So you can really tell that that is their heart.
What do you think it'll be like having a new smile?
I think it's going to be amazing. Like I feel like I've always been held back because I've been insecure with my smile. Like it's prevented me from engaging with people. It's prevented me from even taking an opportunity because I'm not confident in myself.
Yeah.
Just with the way that my smile is. And I know that's something a lot of people focus on. Sometimes it's a first impression, and that's just not something that I've ever been confident with.
Do you know what they'll be doing during the surgery?
Yeah, so I think the first thing that they're gonna do is they're gonna pull out these bottom teeth, the really jagged ones that the gums are receding. There's a lot of pain there. So they're gonna get rid of those. And then I believe they're gonna put a bridge in that's gonna connect to my molars. I think they're gonna start from the canines, I think, and then they're gonna put a bridge there or between them. And then they're gonna do four separate implants, and then they're gonna put in a set that just screws in. I actually don't know.
This looks great in the front, and I think that we can easily hit right in front of the incisal canal. So that's going to be a 3/8 or maybe a 4/2 by 12, no problem. So if I go back 30, so if we're 66, I go back to 36, and really we got nothing there. She's a tougher. She's lost a lot of bone in a very short amount of time with after her extractions. So if I come up to 43, 45, 46, starts to look abundant. So I'm going to see what we have here.
So, you excited?
Yes.
Yeah. Are you nervous?
Very.
What are you nervous about?
I think I'm most nervous about just, I don't know. I'm just nervous because it's unknown.
Yeah.
But I'm more excited than nervous.
Okay. What do you feel like is the exciting part? Like, what are you looking forward to as a patient?
Having a new smile.
Yeah.
Yeah.
Good.
That's our site right there. And that's approaching the first molar. So after alveoloplasty, we got a 4-2. So this one is 24 off midline, and it's 4-2 by 15. And then we've got several sites coming forward into the midline.
How do you feel about the staff? Do you feel good about the doctor you're with?
Yes.
The staff you're with?
Yeah. They're like a family. Yeah. Mm-hmm.
You ready to get started?
Yeah.
Okay.
Yeah.
Or not isthmus in this case, but into the palatal bone. So we've got a double angle going on. I kind of like that site.
Like a 3/8 plus.
Yeah, 3/8 by 8, but depending on the density, by 12 or 15 if we need more torque. Walk in the park. All right.
First on my left.
You'll see Ellie. Right.
Hi.
Hey, how are you?
Good. How are you?
Good. Are you allergic to amoxicillin?
Mm-mm.
Okay, so I'm giving you Halcyon, 1 pill Halcyon, 4 amoxicillins, and an ibuprofen. Okay.
It's stuck in there.
It's a lot of fuss over one little tiny pill.
Are other dentists able to provide this level of care?
Not that I've ever experienced. I mean, I'm not to say that they aren't, but from what I've experienced, I don't think so.
I agree. I don't think so either.
Yeah.
No.
And I've had a lot of work done on my teeth, like, yeah, and
Yeah.
I've never really experienced just the personal level.
Yeah.
And there's no, yeah.
How you feeling? I'd like to have the thing on her finger, the SpO2. I'm gonna poke around, and if it hurts, you tell me, okay? Feel that? Here? Feel that? Not too bad. It's okay here. Here. The last one right in the front here. A little bit. Giving you a little more. That should get it.
Doing great. This is the worst part.
You did good, Candy.
Have you looked at other providers or thought of other plans?
Yes, I have looked at other providers, but I didn't think about other plans, just the financials. Like, they were off the charts, and there was no way coming into recovery that I was going to be able to do that. And that's really what's held me back doing anything or having a new smile, is just the fact that I can't afford it.
Yeah.
I can't afford it. So I wasn't able to consider, if that makes sense.
Yeah.
There's no way.
What was your role in Candy's surgery and treatment plan?
For me, it's just to support the dentist, make sure their supplies are taken care of, making sure she's okay, watching vitals, making sure that they have what they need, everything like clean surface wise. Regular platform, 30 degree, 2 millimeters.
Yellow?
And I like to say I'm a certified hand holder, so just to make sure she's comfortable. And that's ultimately, I feel like, is what kind of gets you to the end of the day, because it's a long day, it's a long surgery. It's tiring for them. So just to kind of know, like, hang in there, you're halfway there, you're 3/4 there, like, because the dentist, like, they're thinking it, but they don't have time because they're trying to work as much as possible. So if you're able to be their communication, so they can just focus and do the dentistry side, like, I feel like it helps a lot.
My role with that case with Candy, with Doc, I was assisting that case. And I was just keeping the field of view clean for him so he could work as fast as possible. With these full arch cases, speed is huge because your anesthetic is a ticking clock. As soon as that gets in there, we want him to stay comfortable for as long as possible. And full arch, it's like that timer's going the second you start.
This part's got a lot of water, Candy, and it's kind of bumpy. I don't want it to hurt you, but you just let us know if you need anything. And this will only be like 3 minutes.
Okay. And breathe through your nose the whole time. Wiggle your toes, breathe through your nose, be somewhere else.
Yeah, go to your happy place. It's just kind of rough, but it doesn't hurt.
Yeah.
Do you think it's different going to a nonprofit clinic? If so, how?
I do, for a lot of different reasons. The main reason is the heart behind it. Because I also work for one, I know, like, they care about the person, the relationship, and it's not just a seat in a chair. They actually see them as a person. And again, they take the time to really get to know the person, their needs, their feelings, their insecurities, and what is bothering them. And they do whatever they can to fix that. Like, that's their main goal, is to fix what you're unhappy with.
So for me, the difference between like corporate dentistry or like smaller DSO versus nonprofit, like the dentistry is still there. You're sometimes in like private practice or like DSO wise, you're pushed more because you're relied on who's pushing you from a higher scale to scale your practice, and then that comes down the pipeline of like me and management. Is there a difference? Sure. But here, nonprofit wise, like I still push them and teach them to look at the mouth comprehensively, because that's how you build your business. Whether you're nonprofit or for profit, looking at the mouth comprehensively, you're helping the patient get back their occlusion, their healthy foundation of their mouth, and like or gum disease and that kind of thing. So I feel like the only thing that really sets it apart is I know I'm here to make sure that my team's taken care of, I can pay bills and do well and give back to the community. Like, we have people who come from homeless shelters that we're able to give free care to, and it's because our dentists do well, our team does well. And I think the foundation is from Dr. McCracken and how he leads us biblically and how to care for people of our community. Like, before I had met him, like, I didn't think of this side of dentistry. Like, I would give people $20,000 treatment plans, and they'd be like hard up on money, or it didn't fit in their budget, and I wasn't allowed to give them a plan B because I was for profit. Like, I was here to help my dentists make money. And so, like, to be able to see people struggling and who come to us who are struggling, and to be able to give them the option of high-end treatment, but hey, there is an alternative. It's up to you, which, you have a Cadillac or you got a Honda Civic, which one would you like? And not necessarily be driven from like a profit standpoint.
They'll fuss at us, I'm sure.
Okay, ready for our scanner.
You need her to draw the ridge?
No, I'm good.
How can a smile change a person's life?
It's really endless.
Yeah.
Yeah, I feel like the main thing, just what we've discussed already, is just confidence. Like, it's like another transformation. Like, it's like a new you.
Yeah.
Like, you get to step into a new you and really engage with people and talk to people and have healthy relationships with people.
You got your notes, Dr. Kumar?
Correct.
How far back are we on this one?
For the right side, you're 24. Midline. Your back
46 with a tip.
Okay.
What stood out to you about working with her as a patient?
Her humbleness, like, you could tell she was uncomfortable, but you could also see like her strength of like, I'm just gonna push through, like the end result's gonna be worth it. Like, I think she even had a headache and she had been in that chair for so long, and so you just get wore out, and to see like perseverance, like, that's amazing, especially after someone who has the background that she has, like, um, to see the self-confidence build up of like, I can do this, I can push through, the end result is going to be so worth it. It's almost like the story of their recovery.
All right, what's our distance back for this one, Tilt?
This one is going to be 22 back.
I know, it's beautiful.
22 back.
Beautiful.
22 back, that 33 tilt.
Get powerball.
I feel like what stood out to me about Candy was just her resilience more than anything. And then also just seeing her as another human and just kind of viewing like, oh my, what if I was going through this, what would I be going through my mind? Just like it's a lot, and I feel like seeing a patient first as just another human trying to get into a better spot, like understanding that first. I feel like she was like just the perfect picture of like she's here for it and she's trying her best and she's there for the day.
This one is a narrow platform, 30 degree, 2 millimeter.
Why are cases like Candy's important for your growth and development as a doctor?
I feel like cases like Candy's are important because it's really, for hers, it was like a moment of she's not too far gone. Like she's been in a denture. She's already had teeth gone for some time. She's lost some bone, but still we could find a way to make what she had work. And that was special to me because it was like it wasn't a very straightforward predictable case. It took some planning, it took some thought, it took some time to figure out what would work with where she was at with her bone levels. And I feel like just never seeing someone as too far gone, always knowing that we can backpedal, we can figure out a solution. That was like something that I learned from her case.
They always change the final, but if they go with that final, it should be okay.
Yeah.
Let's see if I can
Still
rotate it
in.
one more. If I rotate it again, I think we might.
Lose that angle.
It's going to be, you have to get to it. That's not too bad though.
No, it's back, but it's
Backwards.
still forward enough.
I think we can get to it.
I like that it's going to the back tooth, not the canine. Right in there.
Doesn't give us much more room on the buckle, but maybe a little bit. I think I like that other position. What about you?
Yeah, I like it the first one.
Okay.
How would you describe Dr. McCracken's leadership and mentorship style?
I would say Dr. McCracken is the humblest person I've ever met, with just the biggest wealth of knowledge that I've ever met. As a dentist, that is so rare to find too. People that are up there in academics who become a prosthodontist, have a PhD, they're typically kind of prickly. They're not approachable, and Doc will just look at you and answer your question, giving you his undivided attention like you're his kid.
Almost done. You've been a great patient.
He treats all of us with equal respect. There's never an upturned nose at a question that we may have. He comes to the table ready to help and is present with us, and he knows where we're at surgically as well. So he knows, and he gives us that freedom to kind of learn on our own and then come to him when we need him. So it's not like he's over our shoulder just criticizing our work. He's just eager and happy when we succeed.
I mean, I would agree. So I'm here on his business side. So I manage most of his businesses or have some form of involvement to help support him, and just the trust that he gives me, out of nowhere, purely just like tenacity, being able to show myself, or grit, like, and he trusts that I'm going to make the right decision, and that I'm going to make the right decision, like, for him legally and faithfully, like, That's a big thing for me, especially when you come from like a corporate side of dentistry where there was always someone over you, pressuring you to make the right decision or maybe not make the right decision, but to sweep it under the rug. Like, I don't have to worry about that stuff.
Okay. Guys ready for me? That was it.
22.
22 degrees.
I like that.
Great.
Amazing.
That was a 5-second final
I
press.
know. That was insane. Okay.
At Renew,
Mhm.
what do we do through Renew with the girls going there? Like, how do we encourage them to go and have their smile done?
So it's kind of like, I mean, I think you were the guinea pig, really.
Yeah.
Yeah. And then just based off the work that you got
Yeah.
and just how it transformed you and how you became more confident, it's something that people coming out of addiction are struggling to have and have always had.
Yeah.
And I think just you being the person that went there and then just the transformation, it's something that we want all the girls to have. Like, we want people to have that.
Yeah.
Yeah, I want to
Yeah.
have that. Yeah.
Yeah.
How are you feeling?
Pretty good.
Tired?
Yeah.
Yeah. The long surgery, right?
Yeah.
About 4 hours.
Yeah.
So right now we're just waiting for your fixed prosthesis. Like, we're used to calling it a denture, but now there'll be no palate and it'll be screwed in the implants and no movement. So we're just in the waiting game right now. How are you feeling comfortability wise during the surgery? Like, as a patient, how did you feel?
It was pretty comfortable for the most part. I started feeling just a little tiny something here, but they were quick to take care of it.
All right, Doc. How are you? How are you feeling?
Feeling good. Always a good day when we can place implants for people.
For sure. How was the difficulty of the surgery?
Difficulty, I would say this was a 7 on a 10-point scale. We, no surprise going into it. We knew we had adequate bones, not abundant. We would have to do a couple palatal approaches. One site that I was a little more buccal than I thought I would be, but it was a little more narrow in the mouth than it was on the cone beam.
How'd the implants torque out for you today?
Torque was okay, I would say. I was hoping for a little bit more. We undersized, trying to develop a little more torque. We were hitting some opposite cortical plates, trying to get a little more torque, and we came up with a composite of 151, which I'm happy with. I'd like it to be a little bit more that terminal tilted implant on the patient's right side. I wish that was a little higher, so because of that, I'm going to put her on what we call a mush diet for 3 weeks, then move her to a soft diet for another 6 weeks.
And how will this affect her restoration, your torque? Or are we able to restore today, deliver a smile today?
Absolutely. We're hoping to get her smile in today for sure. And long term, everything will heal up great, and we'll get her into zirconia.
How's your spread for this surgery?
Pretty good. We got back to a second premolar on both sides, and we'll cantilever a premolar in the final. Right now, I think the temporary I asked them to make just to the second premolar. And we'll cantilever 8 millimeters in the maxilla. So she'll have 3 premolars on each side final.
What do you hope Candy feels when she sees her final smile?
For me, I hope she sees like completion or like maybe even peace of like we talked about, like sometimes people in addiction, their teeth are like she talked about a diary, a piece in a diary to be able to turn that page. So like completion to be able to pivot and move on from her past.
I would say I hope that she experiences just new hope or renewed hope more than anything. Just that this would just be a reminder that she's worth it and that she can invest in herself at any point in time, and just having that hope that like she can go forward from here and be happy and live confidently and do the things that she needs to do.
Gorgeous.
Thank you.
Are you excited about your new smile and are you nervous?
Yes, I'm so excited because I got the opportunity to see the work that they did with you, and I see the results, and I see the impact that it's made on your life and just how it's changed your life. You're a completely different person. You're confident, you want to smile, and you don't hold back. So that's something that I've never been able to have, and that's something that I want. So I've been really inspired.
I can't wait for you to have
I
that.
know, me
I'm
too.
so
Me
excited.
too.
I can't wait to see the final results. I know it's going to go great.
Me too.
Yeah, just because you're a little swollen, okay? You can look. So just smile, close your teeth together. Yeah. They're beautiful.
When was the first moment you realized this really changed something for me?
As soon as they put the implants in, and as soon as I got to look at them, and then I saw the reactions of everybody, and then I got to look at them, and I automatically felt completely different. I felt automatically more confident.
See, you're just a little swollen right now, but
You look great. It looks fabulous.
So nice.
That's swelling
Look
will go away
amazing.
probably tomorrow.
they look so good. They look so good.
You look really
They
good.
look like.
Congratulations.
Thank you.
You're welcome.
They look like
I love
God-given
them.
teeth. Yeah, they look amazing.
How did it feel to be part of her transformation?
I felt great. I loved it for my team. Not that I get to see these things all the time, but like I'm here to be a servant leader. So like I want my girls or my dogs to be taken care of, like, and to get to everybody pause. She's about to see them, like, and to see like the end result, because it just builds morale. Like from the front desk to the back, everybody cares of who's in that chair, and if she likes her smile, if she's doing okay, like we're all here for that. So it makes my day to see like my doctors happy, and like my even my front staff come back there and like congratulate her because they care so much.
It felt like an honor to be part of Candy's transformation more than anything. I feel like any of these patients that opt for this big surgery, it's just like an honor to be part of that step in their lives towards a longer term solution and something that's it's an investment, but at the same time it's like this will change your life. And I feel like it's just an honor to be part of their story, to be a part of the day that they're given those teeth for the first time, and it's like they're gonna stay, they're up there, they're gonna walk home and smile with them. It's just like knowing you're part of that moment, and then also just knowing that we'll get to see them after, we'll get to see them next week, we'll get to hear like how are they doing, like are you chewing good with them, are you feeling confident, like just being a part of that is special.
Do you want to see them? Can you see them?
Oh, yeah.
They look so good. Wow. You look incredible. They look so good. I'm so happy for you. You did amazing. Thank you.
So
Look at them. They look awesome.
What does Revive Dental mean to you now that you've lived with this transformation?
They mean a lot to me, and they will forever be a part of my story. They will forever be the people that have changed my life, you know? They're kind of like another family to me. I don't really have the words to say how much I appreciate them and just everything that they've done for me. Just the gratitude and appreciation is out of this world.
They look beautiful. They do.
Soft
They
diet.
really do.
You're a great patient,
You are.
Candy. You did so good.
You really were. Thank you, everybody, for everything.
You're welcome.
yeah, for real.
Where has your faith played a role in this season of your life?
It's played a huge part, and it's been really cool because, like we were talking, God knows like all the unspoken things that you don't speak about. He knows the deepest desires of your heart, and it's something that I've always wanted. I've always wanted to have a good smile, which is something that I never had. My parents couldn't afford it. I couldn't afford it. But it's always something that I wanted, and it's always something that's held me back. So it's just been really cool to see how I was planning my own way to go about it, but I just really couldn't afford it. And God came in for the win, and He was like, "Hey, I have this for you." and it's just been really cool. Like, it's something that I've never really wanted to talk to people about because I've been so insecure, but it's really just something that God's kind of put out for me. Yeah.
I love them so much. You deserve it. Thank you.
You're welcome. Enjoy.
How have people responded to you since you got your new smile?
I would say differently because I carry myself differently. Um, I feel like I'm more approachable because I come off more approachable. Like, I'm not trying to hide or, I guess, what's that thing called where it's like a Irish goodbye where I'm always trying to dip out because I don't want to be involved. So I think people want me around more because I want to be around more.
All right, sister, you ready?
Yeah.
Are you still crying? Still crying?
It's because of me.
Ellie started tearing up. And that's when the waterworks come. It's so good.
You really did, though. You did awesome. You couldn't have been a better
They
patient.
look amazing.
They do.
They
They
got
look
Like
so
a full
real.
lip,
Yeah.
full mouth, everything.
They look
Super
so good.
feminine.
Is there anything you're doing now that you avoided before?
Yeah, conversation. Conversation, pictures, pretty much everything. I feel like I didn't want to be involved in it. Like, I was ashamed or like embarrassed. I know this sounds crazy, but I didn't feel like I was a whole person. I know that's one of the first things that people notice about you is your smile. And when you're not happy with it, you kind of don't want people to notice you. So that is definitely something that I'm doing different is I want people to notice me.
So you survived.
Yeah.
You've been in surgery since 9. It's now 3. Surgery stopped at 12, and then we printed in-house your teeth and delivered them. How do you feel?
I love them so much.
Yeah. How does it feel to be able to feel your palate again? Isn't that crazy? Like, that's
Yeah.
a big thing.
It feels amazing. I can't really talk right now because my
Yeah.
mouth. I just got, yeah.
So I would like to thank Dr. Michael and the whole Revive team just for their heart in ministry and just how you can really tell that they want to help people. You can really tell that they like their heart of the whole ministry is to transform lives and to help people. So I just want to thank them for that because before I had come to them, I was very insecure and I kind of didn't want to do life because I didn't want to have conversations or I didn't want to smile. I didn't want to be involved in things. And it's a really kind of, you're embarrassed, I guess. And I just want to thank them for just their heart and just their willingness to want to help people and change lives. And I just want them to know that they've changed my life. I know the journey's not over. So I just want to thank them for their time and just their heart and just their willingness to work with me and transform me and give me a new smile and change my life. Yeah. Renew, I just want to take a second also to say how much I love Renew Women's Discipleship Ministry and just how much they mean to me and just the journey that I've went on with them and just the time that they've spent investing in me and really strengthening my walk with God and just the opportunities that they give other women in my situation. So I love Revive and I love Renew very much. And they've changed my life, both of them.